So I'm in the pub and I'm just about to leave for a new job in South Africa. And my friend says to me, he says, you've got to be careful, man. There's a lot of HIV over there. And I say, yeah, I gather that. And he says, what's the deal now? What's the story? Are we winning with HIV? And I say, do you know what? I think we are. Compared with a decade ago, it's a different disease, 10 years ago, the treatment of HIV consisted of literally a handful of tablets, 30 or more a day, which had really quite severe side effects. And now in 2014, you can treat the illness, not cure it, but prevent the complications with one tablet like this once a day, has 3 drugs in, and you can live into your 70s and 80s. There's less stigma surrounding the disease in this part of the world especially. Men all over Africa are volunteering to be circumcised because it reduces the transmission of HIV. We're really making big steps. And although there aren't enough doctors to handle the problem, allied health professionals, nurses and counsellors are being taught how to treat the condition, so-called task shifting, even community members. And the medications, which cost billions of dollars for pharmaceutical companies to produce, and they're still on patent, are being made freely available to people in the developing world. The ethical issues surrounding HIV treatment have transformed and revolutionised patent law. The technology we have now, we can reduce the transmission of HIV from a mother to a child to almost zero. And the incidence, that's the number of new cases of HIV every year, is decreasing. So incredible leaps have been made with contributions from all sorts of dedicated partners worldwide. And so now I've arrived here in KwaZulu-Natal, which is the easternmost province in South Africa. And sure enough, HIV remains the largest burden of disease. So in this area here, 35% of the population are infected with HIV, and they're streaming into the hospital. I'm in charge of the male medical ward, and so my patients, though, they're not old men suffering with chronic conditions who have lived a good life. They're men in their 20s and 30s, and they're dying of AIDS. And as I look around, they're just clinging to life. Some of them, they're skin and bones. They have that glazed look, which is so typical of progressive disease. And, you think, well, actually, are we winning? And I go around the ward on my ward round, and I'm struggling to examine my patient's chest because there's not a flat area on their chest for me to use my stethoscope because of the protruding ribs. And I'm looking after a 15-year-old boy. He contracted HIV from his mother, and his lungs, they're full of fungus and tuberculosis, and he's just lying there and he's struggling for breath, and he's got terror in his eyes. And his classmates, they arrive and they all surround the bed and they sing to him, and it's like a last goodbye, and there's nothing I can do. I've tried everything I can in terms of treatment. And you think again, are we winning? It's strange because we have all the technology that we need to prevent cases such as these, but it continues because we still have a lot to learn about how we educate people and how we negotiate traditional cultural beliefs. So while we've won a few battles in the advance of biotechnology of HIV medicine, there's the war is still far from over, particularly in terms of the public health approaches that we use. And I wonder if people back home are forgetting about HIV. In the 80s and the 90s, HIV was at the forefront of people's minds. Famous singers and famous actors were dying of the disease. But is the public back home, where I'm from in the UK, are they over it now? It's been incredible to watch the spread of awareness about ALS over the last month. It's a devastating disease, and it deserves the airtime for sure. But, there's about 5,000 people suffering with ALS in the UK at the moment. It's a pretty rare condition. But there's about 5,000 people infected with HIV in a 1-mile radius of where I'm sitting now, and they're dying. And progressive neuromuscular diseases, they're notoriously hard to treat. You need to spend a lot of money to make very small advances in treatment. But all the people around me here need is a bit of education, a few pamphlets, and very cheap interventions actually make a huge difference. But the awareness and the money and the leadership isn't quite there. And it makes you think, is it possible for diseases to become trendy, independent of the net suffering that they cause? And, why is this a problem for me? Is what I am experiencing jealousy? And my friend says, wow, sorry, man, that sounds pretty intense. Are you okay? And I say, yeah, I'm fine. I'm a bit emotional. I've had far too much to drink. And he says, do you want to go and get some chips or something? And I say, yeah, some cheesy chips, some mayonnaise.